Hello, everyone, and welcome to today's presentation. I'm excited to have you here as we explore a very important topic. Today's focus is on transsexualism, also known as gender dysphoria. We'll be discussing what it is, its implications, and some key insights into understanding this condition. Over the next few minutes, I'll guide you through the essential aspects of this subject, so let's get started. Let's look at a typical clinical scenario that illustrates some of the key concepts we'll be discussing today. Meet Sam, a 26-year-old individual who was assigned male at birth. Sam comes into the psychiatry clinic expressing significant distress. This distress is related to a disconnect between his physical body and his gender identity. He shares that he has been living as a woman for the past 2 years, but he still feels that his body doesn't match who he truly is. It's still foreign to him. What's important here is to understand that Sam has no psychosis or cognitive issues. His distress is specifically related to gender incongruence. He is seeking hormone therapy and surgical options to help his physical appearance align more closely with his gender identity. This scenario highlights the core aspects of gender dysphoria, discomfort with one's assigned sex, and a desire to transition to the gender that feels right internally. It also sets the stage for us to explore how these experiences impact mental health and what clinical approaches are helpful. Let's start by understanding what transsexualism, also known as gender dysphoria, really means. It's a condition where there is a significant mismatch between how a person personally experiences their gender and the biological sex they were assigned at birth. This incongruence can cause a lot of distress, and it might even impair their daily functioning. What's important to note here is that this isn't just a matter of preference or identity. It's a real condition that can deeply affect someone's mental and emotional well-being. Recognizing this helps us understand the complexities behind gender identity issues and the importance of supportive, respectful approaches in treatment and care. By understanding the definition, we're better equipped to appreciate the experiences of transgender individuals and the challenges they face, which ties into the overall theme of awareness and sensitivity in our discussion today. Let's take a closer look at the pathophysiology and mechanisms behind gender identity. As we explore this, it's important to understand that the causes are multifactorial, meaning they involve a combination of biological, genetic, and psychosocial influences. No single factor is responsible. Instead, it's a complex interplay of many elements. Neuroimaging studies, such as brain scans, have shown that certain brain structures may differ in individuals with gender dysphoria compared to cisgender individuals. Additionally, hormonal studies suggest that prenatal hormonal exposure, what a developing fetus is exposed to before birth, may play a significant role in shaping gender identity. These findings point to the idea that both biological factors, like brain structure and hormone levels, and genetic influences contribute to how gender identity forms. Understanding these mechanisms helps us appreciate the complexity of gender identity and underscores the importance of a multifaceted approach when considering this topic. It connects to the overall theme of exploring the diverse factors that influence gender development and identity. Let's talk about some of the key clinical features associated with gender dysphoria. One of the main points is a persistent and strong desire to be another gender. This isn't just a passing thought, it's a deeply rooted feeling that endures over time. Another important aspect is discomfort with one's own sex characteristics. This can mean feeling unhappy or distressed about physical traits that align with one's assigned gender at birth. Many individuals also have a conviction that they experience feelings and reactions typical of the other gender. For example, someone assigned male at birth might feel they are emotionally more aligned with female gender norms, or vice versa. Lastly, these feelings often lead to significant distress or impairment, especially in social or occupational settings. This isn't just about personal feelings, it can really impact daily life and functioning. Understanding these features helps us better recognize and support those experiencing gender dysphoria, emphasizing the importance of a compassionate and informed approach. Let's take a closer look at the management overview. First, a psychiatric evaluation is essential to confirm the diagnosis and ensure that other psychiatric conditions are not contributing to the presenting concerns. This step helps us create a solid foundation for the rest of the treatment plan. Next, psychotherapy plays a vital role in providing support to the individual. It helps relieve distress, explore feelings, and facilitate informed decision-making throughout the process. Moving on to hormonal therapy, which is often a key component. For someone assigned male at birth transitioning to female, we typically use estrogen combined with antiandrogens like spironolactone to reduce male characteristics. Conversely, for those transitioning from female to male, testosterone preparations are used to develop male secondary sexual characteristics. After hormonal therapy, gender-affirming surgery can be considered. However, it's usually reserved for individuals who have had sufficient experience living in their identified gender and have ongoing counseling support. This ensures readiness and helps manage expectations. Lastly, social and legal support is crucial. This includes assisting with name and gender marker changes on official documents and helping with community reintegration. These steps are important for social affirmation and improving quality of life. Altogether, these management steps form a comprehensive approach, addressing medical, psychological, and social aspects, and are aligned with the overall goal of supporting individuals through their gender transition in a safe and affirming way. Now, let's talk about some of the adverse effects and complications that can arise with hormone therapy. When it comes to hormonal therapy risks, estrogen therapy can increase the risk of thromboembolism, which means blood clots that can travel to the lungs or brain. It's an important factor to consider, especially in patients with other risk factors. On the other hand, testosterone therapy may lead to polycythemia, which is an increase in red blood cell count that can also raise the risk of blood clots or other complications. Beyond the physical health risks, we also need to be mindful of psychosocial challenges. Many individuals face family or social rejection, which can be incredibly difficult emotionally and socially. Additionally, workplace discrimination remains a significant barrier, impacting job stability and mental well-being. All these factors highlight that while hormone therapy can be incredibly beneficial, it's crucial to approach it with awareness of these potential risks and challenges. This holistic understanding helps us better support our patients throughout their transition journey. All right, let's delve into the trans mnemonic, which serves as a helpful guide through the stages of gender affirmation and alignment. First, T stands for therapy, highlighting the importance of psychological support throughout this journey. It's a crucial starting point to ensure emotional well-being and readiness. Next, R is for reassigning hormones, which involves medical intervention to align physical characteristics with gender identity. Moving on, A represents assessment and diagnosis, a key step where professionals evaluate and confirm the individual's needs and goals. Then, N signifies the creation of a new identity, encompassing both social and legal transitions, such as changing names and documents. Finally, S stands for surgical options, which may be part of the process for some individuals seeking further physical alignment. What's really important here is that this mnemonic illustrates a asterisk progressive sequence asterisk, each stage building on the previous one, representing a thoughtful, step-by-step approach to affirmation and alignment. It's a helpful way to understand the overall process, emphasizing that each person's journey is unique, but often follows this general progression. This concept ties into the broader theme of supporting individuals through a respectful, informed, and individualized transition. Let's wrap up with some important exam and practice notes. Often, you'll see questions related to gender dysphoria in psychiatry, so it's key to understand this area well. One important distinction to remember is that transsexualism is related to gender identity, not sexual orientation. This means that a person's sense of their gender is different from their sexual preferences. Also, keep in mind that early psychological support and multidisciplinary care are crucial. These interventions significantly improve outcomes for individuals experiencing gender dysphoria. Overall, understanding these points will help you approach questions confidently and provide compassionate, informed care in practice.